So a final good afternoon, and thank you again for joining us today. We are so excited to have you here. So before we begin, Kaylee, if you'll go to the next slide for me, I'd like to note that the views written in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide, please. My name is Mackenzie Simmons, and I have the privilege of serving as the project manager for SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that's operated by Altarum. Now let's take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of the webinar. I will now turn this over to my colleague Kaylee to walk you through the webinar interface, including how to submit questions and other technical information.
Thank you, Mackenzie. As you'll see, closed captioning is enabled for today's webinar. If you would like to turn that on, just go to your tab across your screen and click Enable Captions. If you need any technical support or during today's webinar, please reach out using the Q&A function and I will address it for you. Lastly, if you have questions for presenters during the presentation, please enter them into the Q&A area and we will address them as time allows after the presentations during our office hours.
Thanks, Kaylee. Next slide, please. Today's webinar is the third session of 6 in a series of webinars called Connecting to Serve, Promising Practices for 988 and 911 Collaboration. The third session in this series is intended to explore the various ways in which diverse states around the country organize and coordinate with partners to deliver comprehensive crisis care. The goal of this webinar is to discuss and highlight key partnerships and services that come together within jurisdictions to deliver crucial coordinated crisis care. This collaboration will examine the ways in which states, tribes, and territories and their partners triage calls and coordinate and deliver services across the core elements of the crisis care continuum. After attending this webinar, attendees should be able to utilize promising practices to engage with collaborative 988 and 911 partners, such as local PSAPs, mental health providers, state mental health and substance abuse authorities, and emergency responders. They should also conceptualize challenges and identify solutions around the implementation of 988 and 911 collaborative efforts, as well as identify resources available for establishing collaborative partnerships. Next slide, please. Before we start our presentation portion, I'd like to introduce Tiffany Russell. Tiffany serves as the Chief of Crisis and Justice Initiatives within SAMHSA's 988 and Behavioral Health Crisis Coordinating Office, is an advisor to the 988 Director and other members of SAMHSA's senior leadership in planning and determining policy, programs, and activities that address complex challenges in coordination of 988 crisis centers with law enforcement, 911 call centers, and emergency medical services. She also develops, recommends, and implements programs and provisions of guidance related to improving crisis response and equitable access to services for individuals with behavioral health needs that minimize unnecessary law enforcement involvement and promotes diversion from the justice system. At this time, I will hand things over to her for a brief welcome and to introduce our guest speakers.
Thank you, Mackenzie. Hello, everyone, and thank you for joining us. We have made it to the halfway mark of our Connecting to Serve webinar series. To celebrate the midpoint of this series, we have a fantastic program planned for you. But before I move forward, I want to thank and recognize SAMHSA leadership for their continued support of this webinar series. That includes Assistant Secretary Dr. Miriam Delphin-Rittman and her executive team, the Director of the 988 and Behavioral Health Crisis Coordinating Office, Monica Johnson, Deputy Director John Palmieri, Division Directors James Wright and Jill Mays, Senior Advisor Richard McKeon, and each member of the 988 team. I also want to continue to thank the National 911 Program Office and Vibrant Emotional Health for their partnership in developing this series as well. As the federal lead organization of the 988 Suicide and Crisis Lifeline, as well as Behavioral Health Crisis Services Transformation, it is our mission to ensure that every person has someone to call, someone to respond, and a safe place for help when experiencing a behavioral health crisis. The office is working tirelessly to provide support, guidance, and technical assistance to states, jurisdictions, and territories to ensure people across the United States have access to the crisis care they need at their most vulnerable time. This webinar series is just the first of many more opportunities to engage with the 988 team and Crisis Response Training and Technical Assistance Center. More information on how to access these opportunities will be provided by Mackenzie and the team later in this session. Today, I am joined by a panel of subject matter experts within the field, and we'll take a moment to introduce them now. Betsy Schuster serves as the Vice President of Program Development at the Helpline Center. Betsy's passion lies in driving system change and fostering increased collaboration between agencies to ensure more coordinated services for individuals across South Dakota. She collaborates closely with community partners and funding agencies to secure the necessary resources and support for these initiatives. Next, we have Caroline Crehan-Newman. Carolyn is a Crisis Services Coordinator in the Mental Health Services section at the Department of Health Services. She works to support the 988 Suicide and Crisis Lifeline and other crisis services in Wisconsin. Outside of her work at DHS, she sees clients for therapy and private practice and volunteers with Madison Street Medicine, providing behavioral health care to individuals who are homeless. Also joining us is Joshua DiPortolo. Joshua serves as the Senior Manager of Community Integration for the Oklahoma Department of Mental Health and Substance Abuse Services. In his current role, he oversees public partnerships and advocacy relationships, Oklahoma Tobacco Settlement Endowment Trust, HSI grant, and is the liaison to Oklahoma tribal nations. Josh is also a tribal citizen of the Comanche Nation, and in his personal time is actively engaged in the local tribal community. Finally, our last presenter is Tony Stelter. He is a licensed professional counselor and recently, just this week, began his role as the Chief of Statewide Crisis Services for the Oklahoma Department of Mental Health and Substance Abuse Services. Prior to this role, Tony worked for Solari Crisis and Human Services, serving as the Director of Oklahoma's 988 Contact Center for the state of Oklahoma. And with that, I will pass things over to Betsy to get us started.
Well, good afternoon, everybody, or good morning, depending on where you're listening to. I'm so excited to be here today to share a little bit about the amazing work and collaboration that we're doing here in South Dakota. Next slide. I first want to lay the foundation of the Helpline Center. We're a very diverse nonprofit organization in South Dakota, serving South Dakota since 1974. So we're celebrating 50 years, which has definitely helped with our collaboration as we continue to grow 988 and our other programs for the state. So to provide a very large overview, we answer the 211 helpline, which includes responding to disasters where we've worked really closely with 911s. We answer the 988 Lifeline, which we'll focus on today. We have a volunteer connections program. We provide suicide prevention and aftercare services, and we also have family support programs connecting individuals. So our mission is making lives better by giving support, offering hope, and creating connections all day, every day. I think that's a key piece is we're here for those connections and how can we get individuals to where they need to be in their communities across South Dakota. Next slide. At South Dakota as a whole, for those that may not be familiar, we have 66 counties. We have a population around 900,000. We have a lot of our areas are rural, but we do have growing urban areas. And so the Helpline Center, all of our calls for 988 are centrally answered in our Connection Center, which is located in Sioux Falls. We do have offices in Brookings and Rapid City, but all of our phone calls, texts, and chats are centrally located for Sioux Falls for across the state. So we do cover a large geographic range area, but about 900,000 individuals across our state that come into our 988 Lifeline. Next slide. And then we have 33 independent PSAPs. So we work with 33 911s across the state based on the county. So this just sort of gives you, every PSAP has different counties they answer for. So our staff know based on where we need to connect with the PSAP, they know which PSAP to call. So that does mean our staff, when it's time to dispatch, unless they're in our home area of where our connection center is, they can't just call 911. They have to call the 10-digit number to get into that PSAP in that area. So that is something unique that we cannot just pick up and call 911 if we need to connect with them if they're in other parts of the state with a different PSAP. So we'll talk a little bit more of how we've worked through that as well. Next slide. And so just a brief overview of 988 in South Dakota. As I had previously said, 988 is answered by the Helpline Center. We are staffed with individuals with advanced degrees and experience in behavioral health. So for our 988 Lifeline, we require master levels or higher to answer. And so all of our staff have that degree. We also provide supportive follow-up calls and can include follow-up calls from mobile crisis team, discharges from inpatient units, or other programs to support care coordination. And then we partner with public safety, access points, which we'll talk about today, behavioral health providers, psychiatric inpatient. So we really are looking to partner because we want to make sure that the continuity of care is there. And there's always room for opportunity for more collaboration. So we're really excited what we've done in the first 18 months of 988 and where that is growing. And then about on average, 97% of our calls are de-escalated on that call without reducing the need for law enforcement. So we work really hard to work with on de-escalation before dispatching law enforcement. And we have I would be remiss to say we have amazing support through our Department of Social Services Division of Behavioral Health. They have been phenomenal in helping us and funding and all those creating partnerships. And so we are very lucky to have an amazing relationship with our state contacts. Next slide. So as I previously referenced, for those of you, it's a little bit different. So the Helpline Center is somewhat unique where we have, we answer 211, which is the national number for information referral that nonprofits or United Ways answer. We also answer 988. We have two separate teams. So our 211 team answers those calls. Our 988 team answers our 988 calls. And there was some confusion when it was first launched on like, what does that all mean? And so this diagram has been immensely popular. We have them printed. It's one of our most requested posters to help explain when someone would call 211, when someone would call 988, and when someone would call 911. And the best way that I explain this is I have a 4.5-year-old that loves Paw Patrol. And one day I tripped on a toy. And instead of getting mad, I had this light bulb moment of, you have Chase the police dog and you have Marshall the fire dog. And none of us can imagine living in only a community of police or only in a community of fire. But we need both of those entities. We need them working together. We need them collaborating in their own specialty. And that's really what we view in South Dakota, the power of 211, 988, and 911 has. And so when someone needs a food pantry, we want to get that information to them as quickly as possible, most efficiently. And that would be through 211. When someone's in a suicide crisis, a substance use, emotional distress, we want them to get to our crisis counselors on 988 and a medical emergency on 911. But in a moment of crisis, you might forget, you might not remember. And so that's what's really cool is we've really, there's warm handoffs going. 211 will transfer suicide callers to 988 seamlessly. 911 will transfer it to 988 and vice versa if those calls are more appropriately answered by someone else, but the burden isn't back on the individual to recall a number. We seamlessly warm transfer those. So this diagram has been extremely helpful in helping differentiate, but also the importance of the specialty and then the collaboration between the three numbers. Next slide. So to get jumped into our 988 and 911 partnership, I really thought of 4 different T words that really we drove where we're currently at with 911. Is the first word is trust. The Helpline Center, we had trust in this. We also had trust with 911 because of our work with 211, disasters, and NSPL. But that took a lot of years. And so I think it's really important to understand that collaboration happens at the pace of people and the pace of trust. And so you have to start at that trust level of getting to know and understand. I also believe collaboration happens when each entity in the collaboration still feels autonomous to what they need to operate. And so that's built on trust. So we really focus on the trust and openness of every conversation with all of our partners and each of our PSAPs that we work with. Lots of explaining and asking questions to understand both sides of the operation. So before you can get to full collaboration, you have to understand. And so we have taken a lot of time. We've done tours of figuring out like, okay, so this is the goal of when we dispatch to 911. This is where 911 could get frustrated if our staff don't understand that, and vice versa. Sometimes our staff would say, well, we get frustrated because we call 911 and this is what happens. So we really spend a lot of time figuring out what is the operations of both and how do they interact, and training our team. And so then the third T is training, to once again, to build that trust among the team members. And so our team had the opportunity to do ride-alongs with our police department to see how they see 911 dispatches. How does that interact? So the more they understand the system, the better they can see their role in that and how to effectively operate within that system. We also go to every new 911 dispatcher certification course, which was a huge win for us. For years, we had thought about trying to go from our 211 perspective and our NSPL work, but not until 988 was launched where we were able to connect with this. And so in South Dakota, every new 911 dispatcher is required to go through a certification course in our state capital of Pierre. There's 3 2-week certification courses held 3 times a year. And we are now an hour presentation at each of those sessions. So our next one is coming up on March 7th, where our team will go out and really and what's nice is some of those dispatchers have already gone through and been on 911 calls. So we're able to work through scenarios. Usually there's always someone in the room to say, I've taken a call from 988 or I've transferred a call from 988. And that has been huge on building the base level of understanding at the dispatching level and that trust back and forth. And then the fourth one to really talk about is making it tangible, is how can we understand perceptions and understand, okay, within the perception that a dispatcher might have or a 988 crisis counselor might have, is what is the data, what is the reality to that perception, and how can we make that tangible? So with those 4, trust, time, training, and tangible, is sort of those 4 words that really have helped us move our collaboration forward with 911 PSAPs in South Dakota. Next slide. So going back to making it tangible, it's really important for us to share our data. So this is our public dashboard. You can find it on our website, helplinecenter.org, under the 988 tab. And we update this every month. So this is our data from January 1st to December 31st. And so you can see our call volume and our contacts and texts and chats. But then on the other side, on the lower left, we actually put on our public dashboard how many calls were transferred from 911 to 988. And so in 2023, we had 284 calls transferred from 911. We had 222 calls transferred from 211 to our 988 team. I'll tell you, in January, I just saw those numbers. We had 37 calls transferred from 911 to 988. And I think we're going to continue to see more as we continue to build that trust. Part of that trust that I continue to talk about is wherever the call originates from, that entity has that responsibility to make sure whatever happens to that call is what needs to happen. And so you have to build that to say, I trust when I send it to 988, it's going to be taken care of. And so that's why, as we continue to build that education, that collaboration, I really hope, and then with increased marketing of what 988 is, I hope people just call 988 directly. But if they don't, we can still do all those transfers. So I think that we're very transparent with our data publicly on our public dashboard. Next slide. But internally, we have an internal report that we are looking at. So to really start to understand what's happening, where our staff needs is, every morning I get a report along with our leadership team of every single call that was transferred in from 911. And we read through that to see what happens, what is the outcome. With our largest PSAP, which is in Sioux Falls, Metro Communications. They have been phenomenal. They actually were our first to pilot, and we did monthly meetings for over 18 months. We're now on a quarterly meeting basis because we've worked through a lot of those tweaks. But this data has been huge because once in a while we would hear from a dispatcher like, well, every time I transfer to 988, they just transfer back to me. Well, when in reality, when you look at the 911 column, 94% of the time, we don't have to transfer back. That dispatcher might think about the time we did. And so it's important to show them the data to say, when you transfer, 94% of the time, that's not going to come back into the 911 system. In South Dakota, sometimes the reason that it comes back is a transportation issue. Our staff might have still been able to talk to that individual for 15 to 20 minutes, de-escalate the situation, and that individual still might need to get to an inpatient acute care or stabilization unit, but had no other ways for transportation. And so we needed to intervene with law enforcement. However, that situation is very different if that individual can be de-escalated. The other thing is then we spend that time building rapport with that individual saying, hey, we're here for you, call us back. And then we offer follow-up calls as well. And so once in a while, as we were working through our operations of what 911 does and what 988 does, we sometimes joke that 911 is sometimes more black and white. They have a lot of calls coming in and they need to figure out the dispatch. Where 988, we're more of the rapport building. And so one 911 dispatcher said something to me and I said, well, if you talk to someone for 20, 25 minutes, are you probably going to get feedback on that call? And they're like, well, yeah. I said, but on 988, we're working through safety plans. We're working through that. And so I think that was a huge eye opener, is even if we do have to transfer back for a transport, or maybe there was new information shared that they needed in a dispatch immediately, we still had built that rapport and that stabilization and that de-escalation to help that law enforcement officer at the scene and educate them about 988 in the future. So this is a very huge report internally that we're constantly looking at every day to understand what's happening and figuring out where there's more training that needed or collaboration. Next slide, please. So lessons learned, where we're at right now is we currently have 18 of our 33 have signed an official MOU. Sorry, there's a typo. That is my typo with us. Even though if they have not signed an official MOU with us, we will still take their calls and we will still dispatch to them. And so I think that's really important. But 18 of them, and what that MOU is just really helping define our relationship. So we continue to do outreach. Just this week, sometimes it takes multiple calls. And so one of my biggest lessons is, on your first interaction, don't just put the MOU in front of them or send the MOU to them. Build that relationship, help them understand what is 988, how are you guys working within your location, your geographic area, and slowly work up that way to that MOU. And so like we started it with one PSAP, met monthly for over a year, reviewing transfers, breaking down those barriers. And then we have continued to grow. And so just this week, we had another PSAP that we couldn't really get connected with, but we got connected, and there was a personnel change that sort of opened the door for us. And now they're going to connect us with more PSAPs. So just continue, but really focus on that relationship, and don't just send them a blank legal document as your introduction, because that will probably put some barriers up right away. We have also worked very, very well with our 911 state coordinator. He actually just sent us a spreadsheet of all the new contacts that may have changed recently. And so to understand what your 911 system is in your state and figure out where your champions can be within that system, it would be a huge recommendation from our perspective. And so then we provide the base MOU, but we allow each PSAP to slightly modify. Some PSAPs want an outcome from us. So when they transfer a call to us, they want an outcome of what happened, de-escalated, or family member took them to a stabilization unit, or whatever that may be. We have other PSAPs that are like, nope, once we transfer the call, we don't need any outcome. And that's what we identify in that MOU with each PSAP. We also do not, some will say, well, what calls do we have to transfer to you? Ultimately, that is on 911 to say, we're open what needs to work within your procedures and policies. And so when we piloted it with our largest PSAP, it was a very small set of calls that were transferred to us, and then they've slowly opened up what additional calls. And so we walk them through examples, but that is really on them on what calls they want transferred to us, but we help provide guidance. But some of them might have different requirements based on their procedures and policies. So we don't dictate that autonomy decision-making on what calls. We'll take whatever call they transfer to us and handle how we handle with on 988. Next slide. And so that is an overview. If you have questions, certainly for the Q&A, but I am so grateful to share our experiences in South Dakota. So with that, I'll turn it to Caroline, I believe.
Thanks, Betsy. I can't believe I have to follow that. You all are doing really great work. Learned a lot, so thanks. All right, so my name is Caroline Crehan-Newman, and I am a Crisis Services Coordinator at Wisconsin Department of Health Services. Our team here at the state in regards to working on 988 started very small. It was myself, and now it's grown into a much larger team. So I'll talk about that in a moment. The next slide, please. So I'm going to give you all a really brief landscape as to what Wisconsin looks like in regards to our 988 Center and sort of the first responder world. And then my presentation is sort of set up in a chronological order where I talk about 2021 to current day, because it's been a journey, which I'm sure it has been for all of us who are trying to coordinate 988 and 911. So in Wisconsin, we have one statewide 988 center. They're called 988 Wisconsin Lifeline. They're located in Green Bay, Wisconsin, but they have Lifeline counselors working remotely all across the state. So I'm very jealous, Betsy, of your, I think you said 32 or somewhere in the 30s of PSAPs. We have 112 public safety answering points, or ECCs, emergency communication centers, over 400 plus law enforcement agencies, 100 plus EMS companies. So when we're talking about coordinating and doing that handoff, there's a lot of nuance among them. Something that I would imagine is probably consistent across the nation is that our public safety answering points, or PSAPs, there's not one governing body of PSAPs. When I started this work, I thought, why don't I just go to the top and find out who governs and who dictates the rules and regulations of PSAPs across the state? And I quickly learned that that doesn't really exist. And so each and every PSAP has their own way of operating. They also have quite variation in terms of the size and capabilities of what the PSAP can do. So there are some mom and pop PSAPs, maybe there's 2 to 3 employees, and then you have other PSAPs or ECCs that are huge mega centers that dispatch anyone and everyone and have a lot of resources behind them. There are usually several PSAPs within one county. So to Betsy's state diagram, it looked like there was sort of one PSAP per place in terms of counties. We've got a handful of PSAPs within one county. So some of that jurisdiction can get a little confusing. I don't have on here, which I should have, as I think most of us on this call are often focused on how do we bridge the entire crisis continuum? How do we get closer to that crisis now model? So I would be remiss if I did not mention mobile crisis. The way that our local crisis services are administered are through our county crisis program. So we have 72 counties in the state, and nearly all of them are certified to have county crisis programs. And so in addition to having transfers from 988 to a PSAP, we do have a small percentage of people every month that are warm transferred to a county crisis program with the intent of having mobile crisis dispatched. So our actual 988 center does not have the ability to dispatch mobile crisis. Next slide. Okay, so this is an overview of our learning experience. So in 2021, we, as I'm sure many of us on this call who are working on 988, realized the importance of the 911-988 collaboration. In 2021, we received, like many states did, the first ever 988 related grant that came through Vibrant Emotional Health. I think it was the 988 planning grant. And so we created a 988 planning coalition like every state did. And the topic that kept coming up was, okay, what happens when you have a 988 contact who can't be supported through that 988 service? What happens when they're in imminent danger, imminent risk? So that topic just kept resurfacing. So I'll talk about that more in a moment. In 2022, we created a 988-911 Wisconsin specific work group, and that is when at the national level, the National Emergency Number Association, or NENA, created their own work group. Then in 2023, there was sort of a part of the year that was denial and then acceptance of the challenges surrounding the 911-988 collaboration that we had originally hoped to have. And now in 2024, we have sort of a new approach to slow and easy outreach and education to our first responder world. Next slide. Okay, so realizing the importance, like I just mentioned, nearly all discussions talking about appropriately or properly implementing 988 would lead us to a discussion on how we need to coordinate with PSAPs and ECCs. And then I would say once that really came to the forefront, we spent time trying to just learn the basics of PSAPs, ECCs, sheriff's offices, police departments. So although we know it's an unfortunate reality that they play a role within the mental health and substance use crisis continuum, we knew very little about the logistics and the details and just the general landscape of our state. So some of the basics that we learned, like I had mentioned earlier, was that there is no one state agency that oversees all PSAPs or ECCs. I also learned that a lot of the PSAPs or ECCs are actually embedded within a sheriff's office, which just creates different dynamics, different logistics, different cultural considerations. And then to the same point, you do have PSAPs and ECCs that are actually nestled within police departments. So again, just different dynamic, different thing to focus on. We also realized and learned, which I'm curious for presenters after me if this was a concern for you, because I didn't hear it much in Betsy's presentation, but the element of local corporation councils. So I would say one of our biggest challenges and something that we're still trying to navigate and work through are resistance towards making any forward movement because of the fear of liability based on the perspective of local corporation councils. So we started to delve into that world as well in 2021, just realizing that, yeah, you're right. There are corporation councils all over the state. They all have different perspectives based on liability and jurisdiction and transferring and all of that. So 2021, we just were wading into the water, didn't know what we didn't know. Next slide. So in 2022, which is the year that 988 went into effect, our 988 planning coalition had been meeting for about 9 to 12 months at that point. Our goal, again, we didn't know what we didn't know, but our goal was, you know what, it makes the most sense for us to create a non-mandatory, because there is no governing body of PSAPs and ECCs, but we can create something that's a recommendation, non-mandatory, general guidelines for how a PSAP or an ECC should interact with 988 Wisconsin Lifeline. So what does that look like if someone calls a PSAP or an ECC and it's a very clear mental health or substance use challenge where there's no imminent risk of danger to themselves or others? How can we have some 911 diversion right to 988? And then how do we improve the imminent risk transfers that must happen between 988 and 911? So we said, hey, that makes sense. Why don't we create a big comprehensive document? And then about a month or two into having that percolate, trying to create some plans for that, the National Emergency Number Association, NENA, assembled a 911 988 interoperability standards work group, which was for the exact purpose of what we wanted to do in Wisconsin. So we decided, why don't we halt our efforts on that, and why don't we wait and sort of see what NENA comes up with, and maybe we can Wisconsinize these NENA standards. So for those of you who are not familiar, there are two national organizations. One is NENA, and then one is APCO, APCO. Don't remember what that acronym stands for, but those are the closest thing you can get to sort of a governing body or a guiding body within the PSAP ECC world. And so a lot of PSAPs and ECCs will look to NENA or APCO for guidance on how to navigate certain situations or to adopt policies or things like that. But there's no mandatory or regulatory piece around that. So in 2022, by the end of it, we were still just sort of waiting around, hoping that these standards would be released and that we would just read them and say, wow, this all makes a lot of sense. Let's tweak a few things for our state, and then let's take it around the state, and everyone's going to welcome this with open arms, and we'll have no problems. So next slide. Okay, so 2023, denial and acceptance. So we just thought that it would be easier than it was. Tale as old as time. So we took the NENA standards, although they were not formally published, they were really at some of the final stages. I forgot to add, I was a member on that work group, and so was watching the progress that was happening and participating in that. So by the time it had gotten to 2023, I said, you know what, let's take these and let's bring it back to our 988 911 work group, and let's just see what we need to do in order to make this statewide and present this to PSAPs across the state. And really, just to cut to the chase, basically, our biggest challenge, like I mentioned at the top, was managers of PSAPs and ECCs will look at the proposals for what a 911 telecommunicator should do to transfer to 988, what situations would be acceptable, and things will get caught up because of the liability piece. And there's a lot of resistance as to which Betsy touched on, and I'm sure other presenters will probably touch on too, is the culture of 911 is the buck stops with us. We are the catch-all for everything, and our primary and main duty is to dispatch. And so you're telling us that someone calls and says, I'm in a crisis, and we're not going to dispatch someone. That's a really big issue for us. So that has come up time and time again. We did, through one of our grant funds through SAMHSA, we created a 911 988 coordinator position, and that position is focused on an end result. So I'm still in the year 2023 when we were in denial and then acceptance. This person was just going to take these standards and implement them across all 112 PSAPs. And so naturally, we just got resistance because of that legal piece. So next slide. Which leads us to 2024, slow and easy outreach and education. What we've come to see is that we need to do a lot more trust building and outreach and education, and just sort of build this network that hasn't existed and we're in the early stages of creating right now. So that network looks like us at DHS, who is the funder of 988 here in the state, working with our 988 center and working to create connections, relationships, ongoing meetings, just all of that really soft organic outreach piece with our PSAPs, showing them other models across the nation as to how this is working, and doing that relationship building. So we thought we could just really go in and do sort of a wide sweep across the state and help all of those people who call 911 who are really better suited for 988. And we realized very quickly that the culture of mental health and substance use care at certain times is at direct odds with the culture of 911, who is we dispatch someone every single time. We're the last safety net for everyone. And so we're working on bridging that. And our 911 988 coordinator is now focused on relationship building, gauging readiness, providing education, and offering guidelines and standards for those that express interest. So with our outreach team, what we've done is created a 3-tiered approach. And those tiers are tier 1 is an agency, a PSAP, ECC, law enforcement who knows very little about 988, has very little interest in 988, has the mentality of we're 911, we're it. We don't really want to operate with 988 because we've been doing just fine. All the way to tier 3, which is, for example, our Madison, Wisconsin, one of the ECCs here, they already report that they do transfer to 988 when it's appropriate. So they're willing, able, excited to get people who need 988 to 988. And so that's someone who's more in a tier 3, who's looking for a written out MOU process, policies and procedures on how to make that relationship work. And so we have different materials, different sort of dialogue and ways of approaching tier 1, tier 2, and tier 3 to try to make that relationship building and that organic outreach as effective as possible. So that's really to that last bullet point on this slide, pivoting expectations and extending timelines. If you were to tell me in 2021 that this is the approach we'd be taking in 2024, I would have said no way, but here we are, all humbled and better for it. So I think we're doing great work here in Wisconsin, and we're just learning how to make it all work. And I think when we report back out in a year or two, we'll be in a place where we've got more connections with PSAPs and we've got some of those MOUs and more transfers getting to 988. Next slide. And this is my contact. I believe our 911 988 coordinator is on the call. I am presenting instead of her because she's still a little bit new. And so if anyone wants to contact us to coordinate or collaborate or meet, I'll be including our 911 988 coordinator, Melissa Beller, as well. But thank you.
All right. Thank you, Caroline. Appreciate that. Hi, my name is Josh DiBartolo again, and this is Tony Stelter. We're joining you from Oklahoma. So first, we wanted to talk about our coordination collaboration in Oklahoma with our Oklahoma tribal nations, but then also talk about our work with the PSAPs as well, which Tony will do. Here in Oklahoma, we framed the conversation a little bit different. We called it the 988 Mental Health Lifeline. Next slide, please. To give you guys a little bit more of an understanding of what Oklahoma looks like, we have 77 counties across the state. And we have our metropolitan areas that are considered Oklahoma City and Tulsa. Next slide, please. This is to give you a better understanding of when we talk about our urban areas in the state of Oklahoma. Oklahoma City has a population of 694,000 individuals. And then our next largest urban area is Tulsa with 411,000 people. And our land mass area is pretty unique as well. If you see, Oklahoma has a 606 square miles. And then this is in comparison to our Oklahoma counties. So next slide, please. Our next slide talks about our rural Oklahoma area. So Kiowa County is one of the first ones we wanted to discuss. So the population for that entire county in 2020 was 8,345. And then we have another county, K County, which is just north of north central Oklahoma, and has a population of 43,000. So just to give you guys a little bit more of an understanding of what Oklahoma looks like geographically, and then also the differences between our urban and rural areas of Oklahoma. Next slide. And then also, my role as a senior manager of community integration, I also oversee our relationships with Oklahoma tribal nations and have coordinated our approach with the 90-day integration into the Oklahoma crisis continuum of care. And this map is just really a demonstration of where our Oklahoma tribal nations are located, historically located. So a lot of our Oklahoma tribal nations you'll see are vastly different areas throughout the state. Here in Oklahoma, we have 38 federally recognized tribal nations. And then we also have one state recognized tribal nation as well. So multiple different nations and working with sovereign nations is always a unique perspective because every nation is very much different. You work with one nation, everybody's going to be different. And that's how it has been our experience with working with 98 and with Oklahoma tribal nations. Next slide, please. So this is an overlay of 90-day Oklahoma, and I'm going to go ahead and let Tony kind of walk us through.
Yes, and before we came on, Josh said we look like Bert and Ernie, and the reason that is because I was having some internet issues in my office, and Josh was gracious enough to let me walk downstairs and join him in his office and sit right next to him. So that's why you have both of us on the same screen. But yeah, so prior to my current role, I was overseeing the Oklahoma Contact Center for Solari Crisis and Human Services. And so basically how it works, and I think most of y'all understand this, and this kind of gives an understanding of our state, but the part of this I think that's most important is that we have mobile crisis teams in our state, which is a resource that can be both for folks that are calling, just calling 988 Lifeline, but also for folks that are our law enforcement and 911 PSAPs that can also be a resource of getting connected to us. We also are a CCBHC state, which certified community behavioral health clinic state, and we also have urgent care recovery centers as another level of care, and also crisis stabilization units to help divert from longer inpatient stays in hospitals and things like that. Next slide, please.
So monthly here in Oklahoma, we have a monthly Oklahoma and Tribal 90-day meeting. And what we basically do at that meeting is we have our call center, which is Solari here in Oklahoma, where Tony just left. And then also have all of the SAMHSA Tribal 90-day grantees. And then also where we work for is the Oklahoma Department of Mental Health and Substance Abuse Services come together and have a monthly discussion. And then they're usually we just kind of have updates and hear what's going on. So it's a really great time to share and visit and coordinate and collaborate. And even we had our meeting actually earlier this week, and we were actually asking questions about collaboration locally, but then also asking about interactions with tribal law enforcement, which we found really insightful to ask those questions. And then this is in conjunction with our other meetings that we have as our ODMHSAS crisis directors meeting that happens monthly as well. All right, next slide. So talking about working with our tribal communities and tribal nations across Oklahoma, whenever 98 launched in July of 2022 here in Oklahoma, Tony and I came together pretty quickly and came up with a questionnaire wanting to know more about the tribal nation, the tribal community, and also knowing about internal resources and wanting to look at ways that we can help create pathways for referrals for individuals back to tribal behavioral health services if that's what they wanted. We always want to recognize the autonomy of an individual and sometimes not receiving state services is more appropriate, or they would like to go somewhere more culturally appropriate for them. So we wanted to have pathways for those referral processes with tribal nations. So Tony and I came up with this questionnaire. There's a few questions down there, and I really ask about the infrastructure. Not every tribal nation in Oklahoma actually has services. Some of those behavioral health services are actually through Indian Health Services that could be regionally or local. And sometimes the tribal 90-day grantees are honestly just doing some more outreach and kind of spreading the word of the service that is available out there and working on coordination on the backside of things. Next slide, please. So this is the example of a pathway referral process. So from that questionnaire, what we've got the results of was having more of a pathway that kind of talked to about what that tribal nation wanted for their clients as a point of contact. And then also anybody who is a federally recognized tribal citizen or a citizen in that area could also receive services as well. And Tony, working at the call center, really helped with these plans as well. Tony, you have anything to add to the workflow? I know that you guys recommended different things as well.
Yeah, the most important thing is kind of like what Caroline and Betsy mentioned, each PSAP, and we have the same experiences here as far as the PSAPs. Each one of them is their own entity, kind of with their own way of doing things, and it's the same way as far as like the tribes that we're working with. And so the most important thing was working with each tribe, understanding exactly what resources they have, making sure that we're both on the same page whenever those warm transfers happen, and that we have a pathway to do that. And then making sure that that pathway, reassuring us that like whenever we do make that warm transfer, exactly what's going to happen and that client's needs are going to be met. It's a partnership. It's still a collaboration, kind of those constant meetings and check-ins, like through those meetings that Josh has coordinated to making sure that works. So as we develop these pathways, we have, I think right now, as far as with Solari and the tribes in Oklahoma, there's 5 currently right now with 5 different tribes that are direct pathways. And so basically what it is, it's a warm transfer to a number that's specifically for folks that have called 988 that we're warm transferring to. And what those tribes are doing is providing that number, and it's either going to be answered, and if it's not answered, and these are for folks that are low acuity, that aren't in any kind of danger, that are at that point where we're referring them to a resource in the community. And so rather than just giving them a phone number for them to call, we're doing that warm transfer to help close that gap and make sure they get connected. And so those tribes are either answering that phone or they have a voicemail set up, and if they aren't able to answer during that specific time frame, our crisis specialist is instructing that the caller can leave their information for them, and we're staying on the line too to help if any assistance is needed. And then that tribal nation is calling them back, and then they're providing case management, getting them connected in services quickly, and making sure follow-up is happening, and kind of wrapping services around them. All right, next slide, please.
So from listening to the other presenters today, from Betsy and Caroline, one of the aspects that we kept talking about and kept hearing the theme was building those relationships. And much like one of our colleagues said today, not leading with an MOU, right? So I always have this saying, and I shared it with SAMHSA. So these pictures that you're seeing right here from the first tribal 90-day summit that was held here in Oklahoma. And it was all the different grantees coming together for the tribal nations, state and federal representatives all coming together, hanging out and getting to share about 90-day in Oklahoma and how it's working, and recruiting other tribal nations and local community members as well. But I have a perfect saying, and I shared it with SAMHSA whenever they came down, and they were laughing and giggling, and they said I had to share it again. So I feel obligated to say this, but I always tell people to not lead with the ask, and I'm going to help you remember that. So whenever you're thinking of leading with an ask, remember to back that ask up, build a relationship. And I think that these pictures and these relationships we built in Oklahoma with the tribal nations has been so successful because we haven't led with the ask, and we built genuine mutual relationships at the end of the day. And it was a great time to have everybody come together here in Oklahoma. But let's go ahead to our next slide. And much like the other states, we do have a dashboard. I'm going to go hand it over to Tony to talk more about our dashboard.
Yeah, we do have our dashboard here, and I think one of the important stats to talk about is that referrals, top 5 referral resources, and then that police one. So when we started out, it was like 0 to 1%, and it's increasing slowly to 5%. And then also that other box, which is talking about that 911 diversion. And so kind of like our colleagues, you know, in Wisconsin and South Dakota, we started working with the PSAPs to divert calls from 911 and get them over to us, which then allows us to connect folks that may be reaching out through 911. We're providing that more appropriate level of care if it is appropriate for us, that more appropriate intervention, and then getting them connected to, if they're a tribal citizen, getting connected to the tribe if possible, and if that's appropriate. So as you can see, we also have worked out with several law enforcement entities in our state where the law enforcement officers, when they are out in the field and they feel that a mobile crisis team intervention would be most appropriate, or that they would need that assistance as far as helping them make the appropriate assessment for this person if they feel a mental health crisis is happening, they have the ability to call us directly, and we are able to dispatch a mobile team to that officer. All right, you can go to the next slide. And I'm not, so similarly to Wisconsin and South Dakota, we had similar experience. We have 77 counties here in Oklahoma. Each one of those counties have multiple municipalities, which each have their own law enforcement entity. So we have over 100 PSAPs as well. Each of them operates individually. We do have a 911 coordinator for the state, but they don't have any jurisdiction. They provide support. They help with legislation that affects 911 PSAPs. But we did work with the 911 coordinator here in Oklahoma to help develop some transfer protocols from 911 to Solari as the 911 as the 988 contact center for Oklahoma. That's a template. It's not saying this is what you have to do. We found that we've had a difficult time as far as getting MOUs established with our PSAPs. But one thing we have been able to do is we haven't necessarily gotten MOUs, but we have built-in procedures and constant communication with several. Our highest volume county here is Oklahoma County. That's where the highest population is. That's where our state capital is. And also the highest volume as far as for a PSAP also is in Oklahoma City, which is within Oklahoma County. So we have an established relationship with Oklahoma City's PSAP as far as a transfer protocol to us. They have put us into their procedure as part of that process, and also a suburb that's right north of Oklahoma City, Edmond. They have built us into their procedure and even have it built into their CAD system as a transfer to us as well. One of the challenges we faced at first was getting cold transfers in the beginning, because instead of warm transfers, we've worked through that constant communication, constant meetings. Anytime there's an issue, we handle it in real time. I have a point of contact, and I was able to be a point of contact for them as well. And I think that's what really helped us work through it. Training, providing feedback. And as far as our rural counties, we are working our way out into them. We have provided training to one of our rural counties in Comanche County, which is actually where Josh is from. But it's out in the southwestern part of our state. And we've provided training to that PSAP, to their supervisors, who are then able to answer any questions for their staff. They're working on putting us into their procedure and as well. Let's see. We did run into some issues as far as whenever we were first working with Oklahoma City's 911 PSAP. They were trying to route to us via the 988, and sometimes it was not getting to us due to sometimes the number not being recognized as a real number. And for whatever, same thing with law enforcement. Sometimes law enforcement weren't always calling from an Oklahoma area code. And so what we did was develop our own first responder line. So that's a direct number to us. That's just for 911 PSAPs and first responders. We don't hand that out to all of them. We wait until we've had that, they begin having that dialogue with us and those discussions before we're handing that out. But we have provided that to the Oklahoma County, Oklahoma City 911 PSAP, as well as law enforcement and the fire department. So when law enforcement's out in the field, they're able to call that number directly to request mobile dispatch, or just to get a person on the line to call us for de-escalation. 911 has that number as well in order to divert callers to us. we have been starting out with low acuity callers and those that are willing to speak to us here at the Solari 988 contact center. Let's see. Yeah, like I said before, we're able to dispatch mobile teams out to them. And the way, since we haven't been able to work on MOUs, one thing we found is very effective is making sure that they have as part of the procedure. One thing I heard mentioned by one of the previous presenters was 911's kind of mentality that we take care of it ourselves. We've also encountered that here too. Our 911 coordinator for the state makes a very good point whenever he's talking about that. He presents it in a way as, you know, you know, these buckets, you know, you have like medical, you have the law enforcement, and fire, and then you have this other bucket now for mental health. And so he presents it that way, but he also presents in a way as like, you don't mind transferring a call if somebody's asking to have their, you know, having a water issue. You would transfer that person to the water company in their area. And so as long as that person is, you know, not acute and there's not a safety issue, transferring them to 988 for mental health resources or intervention or de-escalation is appropriate. And that seems to be really effective in having those conversations. Now, with that being said, what Josh had spoke about before, those workflows. And so we have many tribes in our state, and they living across the state, rural and urban areas. And so the fact that we have these pathways now in order to transfer folks to the tribes that have those resources, that we have those established relationships. So when we get those 911 diversion calls from PSAPs, we then are able to transfer folks to the most appropriate level of care. We also have warm transfer procedures with the CCBHCs in our areas and other behavioral health providers. All right, next slide.
So I did not plug Tony's info, but if you email me, I will get you connected to Tony Stelter. We appreciate you guys, and we're going to hand it back over.
Thank you so much to all of our presenters. That was a fantastic panel. Super excited that this was the panel we had for the mid part of our series.